There is one test that too many new mums are missing, and I get it, it's just a really busy time. But it could also mean a delay in identifying changes within the cervix, the neck of the womb, that could become cancer. You've just spent 9 months being pregnant and had a delivery, and now you're looking after baby. But HPV and cervical cancer do not wait for anyone. And it's really important that you do this one thing that can really reduce the risk of you getting cancer. If women attended their cervical screening worldwide, it would prevent about 83% of cervical cancers. But don't fear, there is a simple step that you can take today to get right back on track. And we're going to talk about it in this video. I'm Remy, an obstetrics and gynecology doctor and an accredited colposcopist. That's looking at the cervix through a scope to identify any changes that could become cancer. And I'm here today to remind you to please attend your cervical screening and why it's really important. Bleeding in pregnancy is fairly common, and a lot of the times it will be from the pregnancy itself, around the baby, the placenta, but there will be a percentage that will just be bleeding from the neck of the womb. And when I see women like this and I go on to examine them and their cervix looks healthy most of the time, but there is bleeding, I will often say, when was your last smear test? And too many women are not up to date. But when should you be going for your smear test? And I'm going to answer that in this video. Should you be having a smear test while you're pregnant? There is guidance that whilst you're pregnant, if you've had a previously normal smear test and you're due, you just wait till the end of the pregnancy. However, if by the time you're pregnant, you'd had a abnormal test and you needed to go and have the next stage, which is colposcopy, where they look at the cervix with solutions to see if there are any abnormal changes, that is safe for you to do in pregnancy. It's best done when you're at the end of the first trimester or early second trimester. And at that appointment, it's just for the clinician to have a look and really appreciate how the cells look on the cervix. It's probably not the best time to take a biopsy of the cells unless the suspicion for cancer was high, and delaying that biopsy would put you at risk. But again, this is something that you can speak to with your clinician or your obstetrician whilst pregnant. Now, if whilst pregnant you are due to have a smear test, the advice is that you wait until baby has been delivered and wait 12 weeks. And at that 12-week mark, you should go and have your smear test. But what exactly happens at that appointment? I'm hoping that even by clicking on this video, you are someone that has done a smear test before, but if you are not, please listen. In the UK, as cervical screening is a speculum, which goes into the vagina and opens up the vaginal walls so we can see the neck of the womb. And then a brush is put onto the cervix and you're taking sample from the cervix itself. That then goes off to the lab, and in the lab they are testing for something called human papillomavirus, HPV. Now there are different types of HPV. You've got high risk HPV and low risk HPV. And high risk HPV causes a huge proportion of all the cervical cancers we see. But it doesn't just cause cancer of the cervix. And I think it's really important to note that if you are ever found to be HPV positive and you are attending your cervical screening, you need to have it at the back of your mind that this can also cause cancer in the vagina, on the vulva, in the anus, on the penis, and head and neck as well. There's an actor that's really famous for saying that he got his throat or tongue cancer, I can't remember which one, because he gave oral sex. It's really important that not only does it cause cervical cancer, it causes all those other cancers too. But if they take the sample and the HPV high risk is there, then they'll go on and have a look at the cells that they've taken with the brush under the microscope to see if there are any abnormalities within the cells. Then you get sent off to a colposcopist like me, where we assess you again with the speculum, looking at the cervix, but this time putting on solution to see if we can appreciate the abnormal cells. You either have treatment or you have a repeat test in 6 months or 12 months, whatever your clinician advises. Now you might say, but why do we need a speculum for HPV? And the good news is actually we don't anymore. In the UK, it's still first line. However, there are people who are not attending this cervical screening because understandably, that's a really uncomfortable process to have a speculum. And I know I have to do deep breaths and actively push my bottom into the bed just to get through my smear test. I mean, the last one I had was uncomfortable. So there are people who don't go to this because it's uncomfortable. And don't fear, there is an alternative. It's having a HPV test at home. Now you can do that on the NHS, and there are companies that will also provide tests for HPV. It's also just really important to know, if you take the sample yourself and you are found to be HPV positive, you still need to go on and have the smear test and have them take the samples from the neck of the womb, because they need to see under the microscope how abnormal the cells are. It could be lower grade abnormality or higher grade, and the higher grade ones has evidence to show that those will progress on to cervical cancer if they're not treated. That's why it's important to participate in the screening program. I know that there are companies who are producing things alternative to the Speculum, and I cannot wait to see those get the light of day. Back to the issue at hand. That whole process I would hope would be done in the postnatal period. But because pregnancy is not always predictable, it could mean that you've done your smear test, it was abnormal, then you've gotten pregnant, and then you're being invited to colposcopy. And like I said at the top of this video, you should still attend that appointment, because you can have colposcopy whilst you're pregnant. And if you're someone that needed a repeat smear test, as long as it wasn't a higher grade disease, it might be appropriate for you to defer the screening until after pregnancy. That's something that you shouldn't decide on your own, but decide with your doctor involved. So I throw it to you. When was your last smear test? Have you got a record of it? As women, we really need to be aware of when our smear test is due. If you're pregnant or in the postpartum period and your smear test is due or not due, it doesn't matter, because if you have any of these symptoms, I still want you to flag and see your clinician. Symptoms for cervical cancer could be irregular bleeding, a change in your bleeding habit, bleeding after sex, a change in vaginal discharge, pelvic pain, pain on having sex. Those things as well could signal a concern about the cervix that should still be seen with your doctor, and they will refer you on to be seen by a colposcopist. Those are the things that I want you to take away from this video. And if you found it really useful, share it with a friend. Ask your friend when was their last smear test. Make sure people in your community are taking this step to prevent cervical cancer and promote long-term health. Why don't you stick around and watch my video on why you might not feel like having sex so soon after having baby? Subscribe to this channel and don't forget to join that waitlist. Until next time.